Ladies and gentlemen, hello. My name is Dr.Ala KHASAWNEH from Jordan. I am a medical doctor and currently I am a Ph.D Fellow in Hungary PH. My research topic is magnetic resonance imaging in late-onset Pompe disease and post-processing analysis of flexor muscle. Pompe disease, also known as acid alpha-glucosidase deficiency and acid maltase deficiency and glycogen storage disease type 2. Pompe disease is a rare multisystem genetic disorder that is characterized by absence or deficiency of the lysosomal enzyme acid alpha-glucosidase. This disease discovered by the Dutch pathologist Dr.Ala KHASAWNEH Pompe in 1932. And the estimated incidence for this disease is 1 in 40,000 live births. The predominant symptoms in Pompe disease are centered around muscle that could be respiratory as a respiratory failure, diaphragm weakness, sleep disorder, breathing, orthopnea, dysapnea, and cardiac as a cardiomegaly, progressive cardiomyopathy, and gastrointestinal as a difficult showing, poor weight gain, swelling difficulty, gastrophageal reflex, musculoskeletal as a proximal muscle weakness, EMG abnormalities, muscle pain, frequent fails, MRI changes. In the lysosome, G enzyme is required to break down the complex carbohydrate, glycogen, and convert it into simple sugar glucose. In Pompe patient, this enzyme is either missing or deficient or not functioning properly. As a result, glycogen is not adequately broken down and accumulate within cell lysosome, causing damage that leads to muscle weakness. The buildup of glycogen causes the lysosome to expand more and more until they take up so much space, and the glycogen begins to leak out of the lysosome, cause more damage to the surrounding muscle cells. MRI comparison of healthy and Pompe patient. In controls, we can see that the muscle tissue are in dark and visible, but if we compare it to Pompe patient, these muscles are converted to fat. Our study for 3 flexor muscle are basis femoris, semimembranous muscle, semitendinous muscle. If we compare between controls and patient, we can say that the flexor muscle are the most affected muscle in Pompe disease compared to other muscles. There is 2 types of classifications in Pompe disease. First one is early onset. Typically they have a breathing difficulties and trouble feeding, and in some cases can causing death. Second one is late onset. Infected children or adult, for the symptoms they can have weakness of leg and hip, muscle that leading to difficulties with mobilities as well as breathing difficulties, and they may need a respiratory support. To diagnose Pompe disease, we use MRI. So here maybe you can ask why we don't use other methods. The answer is simple, because in example, if we use a CT scan, we put the patient under radiation for a too long time. But with MRI, it just use radio waves and magnetic field, what used to create a detailed images of organs and tissues. Why is the medical imaging important in Pompe disease? MRI is a useful non-invasive technique in the assessment to detect a lipomatous muscle alteration and good tool to calculate muscle volumes in myopathies. MRI is able to identify the early changes in muscle alteration and allow us to follow the muscle alteration during the disease for the possible therapy outcome. In materials and methods, we studied 12 Pompe patients, 11 of them right-sided leg and 1 left-sided leg because of previous surgery, and 12 Pompe controls. The 2 groups are compatible between each other so that there is not much difference between them and to be accurate study. Image processing steps start with the images that was taken by using Siemens 3 Tesla MRI scanner. Next step is image registration. We used FLIRT, so all the different time frame linearly registered together, and these are the settings for the FLIRT. So here we can see the image registration, how it looks like. The next step is manual hand drawing for all 3 muscles in 3 time frames by using FSL program. And here we can see the demonstration how it looks like The next step is to evaluate the T2 value. We used MATLAB program to evaluate the T2 value with specific script. Last step is statistical analysis. We used IPM-SPSS statistical program to count and calculate the difference between controls and patient by using repeated measures ANOVA. In our results, when comparing the MRI data of the three flexor muscles in the lower limb, in patient we detect a significantly higher T2 value in the basis femoris muscle, semitendinous muscle, semimembranous muscle evolve over time, as well as we observed a significant enlargement in the area size of the semitendinous muscle compared to the controls. But the semimembranous muscle, neither basis femoris muscle, doesn't show significant change in the area size. By our results, basis femoris muscle in controls and patient, if we compare between each of them, so we couldn't see any change in the or enlargement in the area size of the muscle. The semimembranous muscle, if we compare between controls and patient, there is no change in the area size of this muscle. In the semitendinous muscle, if we compare between controls and patient, we can see a change in the area size of the muscle. So here visibly you can compare between them. MRI shows that Pompe disease, it results in considerable muscle atrophy, fat infiltration, and replacement of muscle by connective tissue over time. In the 12 patient, glycogen storage can vary extensively between muscle fibers. In previous MRI studies in late-onset Pompe disease revealed changes in quantitative muscle MRI parameters with enzyme replacement therapy and with the practice of various MRI sequences. On the other hand, to our knowledge, there are currently no similar studies allow us to measure quantitative muscle changes with using the T2 sequence over time and compare it with the at-rest time in a short period, what makes us able to identify the early changes in muscle signal of several neuromuscular disorders. As a conclusion, we can say that Pompe patients in the semitendinous muscle are the most affected muscle with the Pompe disease of flexor muscle in the lower limb. Compared to the basis femoris and semimembranous muscle not showing significant change in the area size, even they are affected with Pompe disease. That means the Pompe disease can change the muscle cell structure and cause the muscle to deformation of the original shape, and that leads to muscle weakness. Thank you for your attention and have a great day.